Involuntary childlessness affects around 1 in 7 couples worldwide every year. Though it is not suitable for everyone, intrauterine insemination, or IUI, is one of the first-line treatments for people seeking help with fertility. One of the main disadvantages, however, is a relatively low success rate compared with other reproductive therapies. Slow-release insemination, or SRI, has been shown to enhance conception rates compared with the standard IUI method. This method mimics the natural conception mechanism by slowly releasing sperm over 4 hours. This appears to maximize the opportunity for conception to occur. The EVIE SRI system is an easy-to-use, single-use ambulatory device. To use EVIE, following preparation of the patient, firstly attach the leg strap to the EVIE device and then attach to the patient's right leg. Fill the supplied insemination syringe with 1.5 milliliters of prepared sperm. Remove the catheter from the sterile package and discard the yellow tip protector. Connect the insemination syringe to the catheter injection line. Prime the catheter by advancing the insemination syringe to the 1 milliliter setting and do not disconnect. Disconnect the balloon inflation syringe from the balloon inflation line of the catheter. Fill the syringe with no more than 1 milliliter of sterile saline solution. Reconnect the balloon inflation syringe with the stopcock open. Insert the catheter into the uterus, using the depth marks as a guide. Gradually inflate the balloon with 1 milliliter of saline solution. Close the stopcock to maintain balloon inflation. Pull back gently on the catheter shaft to seat the balloon against and seal the internal cervical os. Remove the device cover by pressing the release tab at the top next to button number 1. Insert the insemination syringe into the cradle of the device. With the syringe in place, reinstall the cover by first inserting the tab at the bottom before finally locking the tab at the top of the device. Disconnect and discard the balloon inflation syringe. Activate the device by pulling out the red safety tab and firmly pressing button number 1. Record the start time on the patient's instructions for removal and give to the patient. Instruct the patient to follow the removal guidelines as follows. After 4 hours, push button number 2 firmly until it moves inward. Make sure that the button remains depressed for a few seconds. Before withdrawing the catheter, the balloon must first be deflated by opening the stopcock on the catheter, as withdrawing the catheter with an inflated balloon may cause pain. You may see a small quantity of saline expelled from the balloon inflation line after the balloon is deflated. Gently withdraw the catheter. Release the leg strap. The EVIE and all the components should be discarded in the bag supplied. EVIE is a superior alternative to standard IUI, which can result in a higher pregnancy success rate. EVIE can also provide a less invasive and more cost-effective alternative to other artificial reproductive therapies, which patients may find more acceptable.